nurses, and other medical professionals make up a country density. Medical density refers to the ratio of doctors, nurses, and other medical professionals to peoples. The number of doctors per 100,000 population is used to calculate medical density. Dentists are responsible for the oral, dental, and gum health. They must also educate patients on a proper dental and gum care. Concerned about the need of considering important change drive and their consequences stem from the fact that future of the dentistry professions and the healthcare business is uncertain. Mouth disease can be avoided. Malaysia offers both public and private dental care. There is a growing recognition of the importance of considering important change drive and their possible effect on the future workforce in the healthcare businesses, including dentists.
I will explain about health workforce and supply trends of dentists in Malaysia. On the screen now are data on the total population and dentists in each Malaysian state from 2015 to 2019. According to the data, Selangor has had the highest population for the past 5 years in a row, followed by Sabah and Johor. For the overall number of dentists in Malaysia, there was an increase of approximately 891 per year, for a total rise of 4,453 dentists in 5 years. Selangor has 2,041 dentists, or around 18.9% of all dentists in the country, making it the state with the most dentists, followed by Kuala Lumpur and Johor. Labuan, on the other side, which had the fewest dentists in 2015, has expanded by 160% to 39 in 2019. Next, according to the WHO, the country needs at least one dentist per 1,000 population to obtain appropriate rates for dentist care services. A large state such as Kuala Lumpur has reached an estimated sufficient level for the population to dentist ratio, which is one dentist for every 1,371 people. However, large states such as Sabah and Sarawak do not meet the average ratio. In Sabah, where there is one dentist for every 8,442 people, we propose the need for 10 more dentists, whereas in Sarawak, where there is one dentist for every 5,278 people, we propose the need for 5 more dentists. On the other side, a small state like Perlis has enough dentists based on its population. In sum, the distribution of dentists in Malaysia is unbalanced across the country. For instance, in the states of Sabah and Sarawak, each dentist serves up to 8,000 patients, whereas in other states, one dentist serves fewer than 5,000 people. Therefore, the government and private sectors should employ more permanent dentists in order to ensure that Sabah and Sarawak have the ideal number of dentists while also maintaining a balance among dentists throughout Malaysia. Thank you.
The first issue is shortage of dentists. Based on the data, Malaysians still do not have enough dentists, which follow the guideline from WHO to make dental services can be delivered with high quality to the patient. Furthermore, Sabah and Sarawak both experience a dentist shortage in rural areas. There is one dentist for every 8,422 patients in Sabah and one dentist for every 5,278 patients in Sarawak. The unwillingness of healthcare professionals to work in rural areas and the high number of dentists retiring are contributing causes of the shortage. Despite the dentist shortages, the patient must wait a long time for treatment at the clinic. Other than that, when dental care is delayed, it is conceivable that the patient can develop additional issue or that the toothache will worsen. According to Muhammad Noor 2020, Malaysians require orthodontic more. The 3 to 5 year orthodontic wait at public district clinic prove this. Young individuals have adopted the practice of wearing braces to demonstrate that they are up to date with the newer newest fashion trends. They are even willing to receive orthodontic treatment from people without the necessary qualification. This is due to the lengthy waiting list at the public clinic and the desire for cheaper care. Thus, it demonstrated that there are several negative effects if the lack of dentists and a solution is not found. The second issue is inadequate public dental clinics. A total of 64 districts has fewer than 10 dental clinics, and 11.3% of the population of Malaysia does not live within 20 kilometers of a dental clinic. The ratio of dental clinic to the population was 1 clinic to 9,000, with public clinic serving a population of every 1 clinic to 38,000 and private clinic serving a population of every 1 clinic to 13 population. In addition, overcrowding at these public dental clinic will cause dentists to burn out from treated existing patients. Based on the study conducted by RAHA B 2017 demonstrated that clinic crowding has a detrimental effect on two groups of patients and dentists. Therefore, it can be proven that when health facilities are not spread out evenly, many people from nearby and remote areas or rural areas will come to an urban public dental clinic. This can cause public clinic to be overcrowding, and a large number of patients that they need to be handled can cause dentists to have a serious problem with their physiological health, which make it hard for them to give a good service to patients. That's all from me. Thank you.
For the first way to overcome is to increase dental clinics in rural areas. Although it will be a challenge to increase accessibility of dental services in rural areas due to lack of accessible roads and transportations, therefore the government need to identify the major factors such as education and regulatory interventions, monetary compensation and management, environment and social support, because it is important to recognize change driver and their potential sequences. The government also need to provide a lot of dental clinics, either government or private, because both play an important role in this industry. Besides, the government also need to take an action by investing in dental industry in terms of dental clinics, machinery and tools, providing a higher quality training to improve dentist skill and many more. Next is increasing dental institution. For your information, the shortage of manpower was one of the major issues that heavily impacted, especially in rural areas. To increase the number of dentists, the government needs to provide a training, even though it will incur a higher cost for the government. There is an evidence to suggest favorable impact of these programs in recruiting students who go on to assist rural and underprivileged communities. The development of oral health access impoverished areas once the government stated providing primary care doctors with these services. However, there is no evidence about long-term recruitment and retention of dental practitioners in rural areas. Therefore, reinforcing rural interests must be accompanied by permanent employment possibilities. For example, physicians can be employed without incurring the additional cost of setting up their business.
According to research, Malaysia continues to lack dentists who follow the WHO norms in order to provide a high-quality dental care. Malaysia is now a middle-income country with an aging population. When health services are not evenly distributed, many people from local and remote locations visit urban public dental clinics. This may cause overcrowding in public clinics. More permanent dentists should be hired by the government and commercial sector to balance dentists in Sabah and Sarawak in Malaysia. We conducted this investigation to verify that our country has an adequate number of dentists. This will ensure that everyone should receive care as soon as possible. We also hope that the Malaysian Ministry of Health would make it possible for rural population to receive treatments. We believe that finding of this study would persuade the Ministry of Health to examine whether Malaysia has enough dentists. That's all from us. Thank